Hi, my name is Amalfi Borro, and I will be presenting Crohn's disease for my signature assignment. Crohn's disease is an inflammatory bowel disease that can affect anywhere in the digestive tract. However, it mainly affects the small intestine lining and the large intestine lining. The cause for Crohn's disease is still unknown. However, some researchers believe there to be a link between a person's genes and Crohn's disease and also environmental factors that can cause Crohn's disease. As for its demographics, it's often found in North America, Northern Europe, and New Zealand. And treatments include medications and also surgeries and anti TNF medications also. For the etiology of Crohn's disease, uh, while the exact cause for Crohn's disease has not been found, researchers have theorized two possible ways or causes as to why a person may develop Crohn's disease and also how they may develop it. One of the first theories is genes. Certain genes may make people more susceptible to Crohn's disease, such as NOD2. Researchers found that with NOD2, they're linked to changes in fibroblasts and immune cells whenever Crohn's disease creates lesions. These these fibroblasts were shown signs of activation when produced and produced factors involved in inflammation. Another thing they found is that individuals who have parents that have Crohn's disease, or both parents that have Crohn's disease, often have a 35% chance of developing Crohn's disease. As for the environmental factors that may cause Crohn's disease, it's shown that smoking may double the chances of developing Crohn's disease and also a high fat diet. As for who it affects, it's often identified in North America, Northern Europe, and New Zealand, and will occur through the ages of 15 through 60. The main individuals that it'll affect are individuals with Northern European uh, descent and also Jewish descent. For the anatomy and physiology of Crohn's disease, it mainly affects the whole digestive tract, but largely affects the colon and small intestine. What first happens is it creates just patches of inflammation throughout the intestines, and these inflammation often reoccur throughout their lifespan, and will cause non-caseating granulomas, which are just inflammatory lesions that are made up of immune cells such as like T cells, and are not technically dead tissue. After creating those areas of inflammation, it will develop ulcers throughout the intestinal mucosa, creating a more cobblestone-like appearance. And these like constant inflammation effects can lead the intestine to develop strictures and intestinal blockage from the thickened walls due to the inflammation. The inflammation basically thickens the area, creating that intestinal blockage. For the symptoms of Crohn's disease, it often coincides with IBD, as it is a form of IBD. But other symptoms that may be shown are ulcers, which result from the inflammation in the intestine wall, intestinal strictures, which are caused by the thickening of the intestinal wall because of the inflammation flare ups, abscesses that can be filled with pus, and anal fissures, which create small tears in the lining of the anus. For the diagnosis and treatments, the diagnosis side, there are two ways for it to be evaluated. The first way is through lab testing, and the other is through image screening. And then, as for the treatments, it's often broken down into two phases: the induction phase and the maintenance phase. These phases are often done through medication, whereas another procedure may be done if the inflammation gets worse enough. For the diagnosis of Crohn's disease, on the lab test side, there are three types of lab tests that may be done. First is a stool test, or either a blood test or a special serologic test. The stool test, it helps rule out the case being an infection rather than it being Crohn's disease, while also detecting like active inflammation of Crohn's disease. Next up is the blood test, which can detect the increase of antibodies in like the intestines, but also identifies levels of creatine, urea, and electrolytes throughout the body. Lastly is a special serologic test, which help identify the severity of inflammation. In the image on the left, it shows how uh, severe, severe inflammation may be identified. Another way of testing is through screening. Imaging and screening include X-rays, ultrasounds, MRIs, colonoscopies, and video capsule endoscopies. X-rays can show intestinal blockage or obstructions throughout the intestines. However, it can't detect abscesses, ulcers, or fistulas. Ultrasounds, however, can detect abscesses, but also detect the blood flow of the superior mesenteric artery, which help identify like how how severe the inflammation is. MRIs can help detect abscesses, but also detect strictures and fistulae. Colonoscopies can help assess the severity of inflammation and also allow the doctor to collect tissue for testing. And video capsule endoscopies help a patient easier visualize Crohn's disease, as sometimes it can be hard to explain that, oh, there's just inflammation throughout the intestine. For the treatments, it's often done through medication with the two phases. The first phase being induction phase, which is the treatment of controlling inflammation within 3 months of first developing Crohn's disease, and often this may be done with mesalamines and sulfazines. These are anti-inflammatory medications, but they're more often used with another uh, bowel syndrome or bowel disease called ulcerative colitis. Another medication that may be used is corticosteroids, which induce flare remissions. Basically, what happens is that it reduces the effects of like inflammation flare-ups in the affected areas. Uh, this medications is also used for long-term maintenance phase during care for Crohn's disease. However, it has more adverse effects long-term. In the maintenance phase, while although corticosteroids may be used, it's often medications often used are immunomodulators, which reduce the flare-ups, but in a safer and slower effect, and along with anti-TNF agents, which are basically they prevent tumor necrosis factor by preventing the tumor necrosis factor TNF from binding to its receptors and reduce inflammation by stopping the activation of a protein. Another treatment is for when the inflammation is so severe that the hospital or the patient will undergo surgery where they mainly remove the large intestine that is usually affected from Crohn's disease and connect the small intestine to the rectum. This is usually happens when obstructions like the thickening of the walls is too much or too many abscesses and fistulas are no longer being able to be maintained through the maintenance phase. Lastly, the inclusion of AI. Many researchers believe that AI will have a greater role in the future of developing care for IBD, and IBD and other related diseases such as Crohn's disease. It can help find any associated genes or treatment targets, help predict the development of IBD or Crohn's disease, help easily characterize Crohn's disease, have a much more active prediction response, better treatments, more efficient follow-ups, and detection of neoplasia. On my last page, these are all the references I use, mainly coming from NIH and other reputable uh, medical sites. That's about it. See ya.